Hi everyone, welcome to this webinar. I'm Dr. YaoLin Tang. First, I'd like to thank HealthBio for this opportunity. In the next 25 minutes, I will be sharing with you how I'm preparing the anterior in order to get the predictable final result with the amber meal. A little bit about me. First, I graduated from Taipei Medical University School of Dentistry in 1991. Then I came to San Francisco, graduated from UOP, now is the Arthur Duconi School of Dentistry in 1994. I'm a CDoc visiting faculty and also a Peterson and Serona certified CEREC trainers. Golden Gate Bridge is the most iconic site of San Francisco. But we also have the Bay Bridge that connects between San Francisco and Oakland. This 27-year-old lady came to my office as an emergency patient a little bit over a month ago with 3 fractured front teeth from tooth number 8 to number 10. The international number is number 11, 21, and 22. Tooth number 11 and 22 has horizontal fractures, and tooth 21 has with a grade 1 mobility and with a fracture line. In this webinar, I'm using this case to show you how I prepare the teeth step by step and some tips and tricks in order to get to this result. Let's talk about the preparation for the anterior CEREC. For veneer and crown preparation, they are pretty much the same. The difference are if you are prepping the lingual to be a crown, or for veneer if you are breaking the proximal contact and reducing the incisal. There are a few things we need to know before we actually prepping the tooth. First, we need to know the morphology of the enamel. We need to know the variation of the enamel thickness. We want to keep as much enamel as possible to be able to bond with. See the enamel thickness vary. It's down to 0.3-0.4 millimeters at the cervical area. We want to try to preserve the enamel if possible for our adhesive dentistry. Second, needed to be considered is the color change. How much whiter or brighter that we need to achieve than the existing. If no shade change needed, 0.3 millimeter or even less reduction will be enough. But we will need to prep more aggressively if significant shade change required. Third, that needed to be considered regarding prepping will be the tooth's existing conditions. The tooth's existing condition that may include how big is the decay and the condition of the existing composite. Do you need to replace the composite? How deep is the recurrent decay under the existing fillings? And also, is the tooth discolored? How dark is the stump shape? Do you need to place an opaque layer to cover the dark stump? We also need to consider tooth's existing position too. How far out is the tooth that we need to restore? How much prep is needed in order to bring it back to alignment? Would the aggressive prepping ended up needing the root canal treatment? We do need to discuss all the possibility with the patient ahead of the treatment, ahead of the preparing the teeth. After we have all things that we need to consider in our mind, then first thing we need to do are the records. The record include the pre-op photo and the impressions. Impression can be physical impression like PVS or digital if you have intraoral scanners. If you prefer the digital way like me, I use my prime scan to do my pre-op scan. So this is the pre-op photo. The scan was also taken including the upper, lower, and the buccal bite for the digital wakes-up. Here is a digital wakes-up screenshot. I then 3D printed the STL at 100 micron with a phone lead model resin. After getting the records, we need to do the shade taking too. I have few tools in my toolbox for shade taking. The first one is a Vita Easy Shade. I grab the Easy Shade first and take a quick scan to give me a quick starting point. If I'm doing the posteriors, I normally use my Vita Classic shade guide. My Classic shade guide was arranged based on the value from the brightest to darkest, not by the A, B, C, D groups. For anterior, more critical cases, I need to use the Vita 3D linear shade guide. It is a two-step process. Very easy and straightforward. You first use a shade tape on the top shelf. It goes by 0, 1, 2, 3, 4, and 5. You first use a shade tape on the top shelf to pick the value among the 6 tapes. Once you decide one of the value, let's say if you got the 2 value, then you will go down to the bottom shelf and pick the number 2 shade guide out. So now we finally going to pick up our handpiece and start to prepping the teeth. And this is my first set for my veneer prep by Meissingers. So the burr kit comes with 2 facial depth cut burr. One is 0.3 and the other one is 0.5 millimeters. For this case, I only use 0.3 millimeters since I did not need to change the shade and I want to keep the maximum amount of the enamel. Here is an A34 0.3 millimeter burr for other case. After making the depth cut on the both on the facial, mark the depth cut groove with pencil. Then you use a A69010 to remove all the pencil marks and connect 3 reduction plane to ensure I got 0.3 millimeter reduction evenly on facial. Use this burr to break contact if needed. When you break in the contact, you can put a metal matrix band in between to protect the neighbor tooth. And then you will use the facial reduction jig to make sure you have just the right amount of the facial reductions. Then you use a A28T 1.5 to do the incisal reduction guide cut. And this is the incisal reduction jig, just to ensure that again you have enough incisal reductions. And if you are doing a crown prep, you then can use a football diamond to prep the lingual. And use the A39R or the size 1 round burr to finalize your crown or veneer margins. Prep need to be smooth and rounded without any sharp angle. I use Cosmedan polishing disc to do my final polishing, or you can use the white stone to polish your prep. The coarse disc is very stiff, make it very difficult to adapt to the prep. You can use a scissor to cut the disc that I show here to make it more adaptable. Hi, in this video I will show you how to do 3 different silicone jig. The first silicone jig will be for the reductions. So you want to make sure your model is nice and clean, and you can use alcohol wipe to make it clean. Okay, so this is our digital wax-up model that I 3D printed with the 100 micron resolutions, and we're gonna make off our silicone jig by using this wax-up model. And this patient, I'm doing a 3-unit crown, so it will be from number 8, number 9, and number 10. So the silicone that we're going to use today is a Zermac Platinum 85. This silicone is very hard, so that's why we need to use this silicone as our index. So for the first reduction index, you will need approximately about 2/3 of the spoon for the silicone. Okay, just like that. Then you're gonna make it like a, make it flat. And then you're gonna mix both parts together. You fold, and squeeze until this has become a very even color. Okay, so the color is pretty much even. Now you want to make it a sausage, a small sausage type. And now we have my digital wax-up 3D printing model. Put this little sausage on the facial surface of the model. Use your palm to squeeze, and you go from premolar to premolar. Put pressure with your palm, and then at the premolar area, make a flat surface for the occlusal stop, and you want to leave a good 5 to 7 millimeter thickness of this index. And then we wait for this to set. Okay, so you're gonna wait until it fully set, and you try to get an indentation, and you don't get indentation anymore. That's showing you that the silicone index has been fully set. And you will remove from the model, and you can see all the detail that you capture from that silicone index. And now we're gonna need to prepare this silicone index by cutting it. So again, these patients I'm doing from 8, 9, and 10. And normally if you're doing a 6 unit from 6 to 11, then you will open a window from 6 all the way to 11. But again, because I'm only doing 8, 9, and 10, so I'm going to open a window from 8 to 10 only. Okay, so now we are making the mark for where we're gonna cut for our index. So again, I'm doing 8, 9, 10, but this one I'm just gonna cut from somewhere around 7 all the way to 10. And again, if you're doing 6 to 11, then you're gonna cut from between 5 to 6 and then between 11 to 12. And you will mark the 1/3 of the length, which is the incisor third of the tooth that you're going to prepare. Okay, and then you're going to make 2 vertical cut from here too. And then you will use a brand new number 11 scalpel to cut. So first, you're going to cut from inside out on your mark. Make sure you go all the way through. And then you cut from the top. Then you make your reduction index. So again, you're gonna use this reduction index to make sure you have good enough and just perfect amount of reduction on the facial of the anterior teeth. And so again, I will show you some of these clinical picture of how I use it. But this is the patient that after prep I scan, for the final restorations, and I 3D printed it again 100 micron resolutions. So this is how the silicone index look like intraorally, to showing you that you have enough facial reductions. All right, so the next index I'm going to show you is the incisor reduction index. So again, you're going to use the same silicone, and this incisor index will be a lot smaller, so you just need about half spoon. And again, make sure your hand is nice and clean so you are free of the contamination. So about half spoon for each. So the same technique, you fold and squeeze until the color is even. And this time it looks even now, and instead of making a sausage, now I'm making a ball, a fish ball, or whatever meatball, small meatball you would like. Okay, and then you're gonna put on a lingual, the palatal of the prep teeth. Again, if you are doing from 6 to 6, you're gonna go from premolar to premolar, just like that. Adapt to the lingual surface. And just barely touch the incisor. And if you like, you can actually put on the surface of the desk, slightly push, like that. So now when it's fully set again, don't leave any indentations. When you push it, now you're gonna cut off the additional, over the model, cut it off. That way we can guarantee that incisal index will fully set it. So after I cut off the palatal side, make sure the index can be fully seated again. So this is the final incisal index. And look at the detail that you capture with the index. So again, I have my prep model, and this kind of show you that the silicone index sit on that prep model. So make sure you have enough incisal reductions. Okay, so now the last index that I like to show you is a markup index, or you can use that index for your temporary. So for this index, you're gonna need about 2/3 of the spoon. And you already know how to mix it until you see a very even color, normal white strip. And then same thing, you make a sausage-like shape, and the length will be similar to your model from premolar to premolar. And now, instead of putting on the buccal side, you want to do it from occlusal surface. Again, from premolar to premolar. And then you're going to form your finger a V shape. And you can use your palm again to make the facial surface nice. Put some pressure on the buccal. You don't have to worry about too much on the palatal. Okay, so now here is the markup index. So this is how it fit intraorally. And what you want to do is you want to mark the facial surface. You want to cover about 2 to 3, minimum 2 to 3 millimeters of the gingival from premolar to premolar. And again, I'm doing only 8, 9, 10, but I'm going to just cut it from 7 to 10. So you do a horizontal cut. This brand new number 11 blade will help because it make it a lot easier for you to trim. And now on the lingual, if you're doing a veneer, you want to have access to the middle third of the lingual surface of your prep teeth. So you want to mark, again, if you are doing 7 to 10 or 6 to 11, you can mark from 6 all the way to 11. But again, my case, this one, I don't even need to use this one, but I'm just gonna make it as a demo to show you. So you're gonna mark the lingual mid-third of your prep teeth. All right, so you will make a horizontal cut on this one. You can make a multiple trim little by little. And what you have to care for is you don't want to accidentally put your blade touch the facial surface of the index and destroy that facial surface of this markup index or your temporary index. So let's put this one on the wakes up model. All right, so this was showing you that when you put on this markup or temporary index on the patient's teeth, when you're doing your markup or when you do your temporary, you still have the access to the lingual aspect of those prep teeth. So when you're doing your temporary, you can actually oral markup, you have access to go in there to remove that additional resin or composite or whatever material that you use. And you will also want to make 2 vertical cut here to the end. That way you can visualize, make sure your index has sit 100% on the teeth, and you can also cut an index between 8 and 9 for your reference, midline reference. So there you go. This is your markup or temporary index. Hi, Okay, so here is your emotional markup to get patient's approval. If you do have the chance and needed to do the emotional markup, but sometimes you do need to do some prepping in order to sit the markup jig all the way. Just like this case, it's not 100% additive. So you can see here the screenshot using in-depth software overlay the pre-op and the wakes up model to see the area that needed to be reduced before you can do the markup. So after the prep, then the rest will be very straightforward. And here is the final. Before and after. So you can find me on Facebook, and also you can email me. And thank you for your time, and hope everyone staying safe and healthy during this pandemic. And hope to see you in person some days.